Today we have Andrew come in to talk to us. Let's have a listen.
Thanks, Priya. I'm Andrew Wenzel. I'm the manager of Headspace Albany. So we're a part of the national network of Headspace centres, and we work in youth health, and I guess 3/4 of what young people 12 to 25 seek help for is mental health. And so we're like all Headspace centres around Australia, a primary health service, so people don't need a referral. They can walk in, they can call us up. Sometimes that might be young people themselves. What we often find is it's young people with the help of someone, and that might be a parent, it might be a friend, it might be an older sibling or a partner. Sometimes it's other health professionals, sometimes it's employers or managers, teachers, because often, the research shows that about half of young people probably won't ask for help when they need it for mental health reasons. That might be for a whole lot of reasons. It might be because they don't know what to do, they don't know who to ask, or they're just afraid of what might happen, or the stigma associated with mental health stuff as well. So sometimes the best thing that you as allied health professionals can do is to give someone permission to express their feelings. I think especially in often a lot of physical health disciplines, people sort of think, well, I work with the body, and that we have this sort of bizarre set of assumptions that the body is from here down and they're not connected, and of course they are. And I guess you'll all be aware, and massage especially, where physical contact and physical changes can have psychological effects, or sometimes people can find
get up off the table and cry
and burst into tears, or just have these profound emotional responses. So I think often we talk about difficult emotions, or emotions are sort of characterised into ones that are okay to have, the good emotions. So it's okay to be happy, and I think, but it's not okay to be sad, or it's not okay to make someone else feel uncomfortable with your emotions. And so I think the biggest thing is to create spaces and environments where it's okay for people to express how they're feeling. We shouldn't have to cover up one set of health-related issues to deal with another set of health-related issues. And I think most health professionals have probably had that experience where someone's coming in to see you for knee pain, and you say, how are you going? And they just well up with tears, and how you're going is actually nothing to do with the knee pain. And so creating those sort of environments where it's okay for people to express those things, and they need to feel shame with admitting when they're struggling, or talking about what's going on for them, and sometimes those environments where you're with someone just for a period of time, and things create that sort of space where people fill up with what's going on in their lives as well.
So we deal with a lot of musculoskeletal problems here, and I guess what advice do you have for people that have chronic pain, and in terms of their mental health and chronic pain relationship?
That's a really powerful area, and an area that often comes with a lot of loaded information and a lot of misinformation, and often people have had the experience because, and as a doctor, and I'll sort of claim some of our professions, perhaps lack of tact in speaking things. We focus on as doctors looking for physical causes of pain. I think increasingly there is, and there should be, an awareness that pain, it's that people perceive pain. We can't externally monitor for it. And it's the perception of pain that is real regardless of whether there's an organic cause or not.
Okay.
So people often have heard, whether they've genuinely been told or not, but they have heard there's nothing wrong with you, or which they interpret as your pain isn't real. And we know that's not the case. You know, it's more correct to say, you know, this particular investigation hasn't turned up a result that immediately points to what the cause of the pain is, but you are still experiencing pain, and what we need to do is work with that. I think people, you know, our entire health system is tuned to asking questions about what's causing this, and when we don't know a definitive answer, or where it's multifactorial, there's lots of causes, that's difficult to work with. And sometimes we're also set up as the health industry, to cure things and for things to return to normal, and that's not always possible either. So sometimes it's working with someone to say, what we maybe need to do is think about the fact that your pain may not get better, or may not go away, but there are certainly things that we can do working with you to minimise the impact of your pain, or to learn strategies to enable you to live a life with pain, unfortunately, as a part of that life.
And dealing with the mental health issues goes a huge way into managing that pain that they may be experiencing.
Very much so, and I think so. Part of it is trying to, if there is anger or a misattribution of pain, allowing that to happen, because we also know that things like anger and pain have a powerful effect on things like depression and anxiety, and then these things can become loops. So part of it is finding ways to manage pain, and that we're not looking maybe for pain to go away completely, but we're looking for it to lessen. Certainly encouraging, you know, all the things that we used to probably say as health professionals, like rest and things we know and now are not good strategies, and you know, waiting for it to go away. So it's living a functional life with what's going on for you, and whether that's chronic injury, whether it's pain, whether it's you know, some degree of physical impairment or disability that comes with whatever physical issues are going on, helping people accommodate that rather than expecting things can go back to how they were. It's finding a new adjustment, and encouraging pain to be a response to pain to be multifactorial and multidisciplinary. So certainly counselling and psychology and mental health has a really powerful role to play in helping people cope with pain, helping people cope with the anger and the loss of function that comes with that loss of role, as well as maximising mobility and helping people understand that you need to find a functional balance with pain. So allowing people to be angry about that sort of stuff in your spaces, as well as saying, you know, have you thought about speaking to someone about it, and it's not, and being really clear that it's not because I'm saying this is in your head, but I'm saying your head has a powerful influence over it. And you know, there's heaps of little anecdotes that you can use to help explain that to someone. So things like, you know, the motivational walking over hot coals, people doing amazing things when they're, you know, rescuing people from fire and not realising that they've had these massive physical injuries until afterwards. You know, our body and our mind has a really powerful role in helping us manage a whole heap of physical sensations. And part of it is learning to use these to your advantage, kind of thing. And so counselling and mental health intervention is about that, as well as dealing with often the grief and loss associated with chronic pain, or if injury has resulted in someone having to change their occupation or their functional role, there's grief and loss associated with that. So I think encouraging people to seek help as a part of what's going on with their mental health can just result in, opening people up to that possibility that, this could help. And doing it in a way that isn't sort of being really explicit that this is not because I'm telling you, this is in your head, because that's sometimes what people hear, particularly if someone's going through anxiety and depression associated with what's going on. Our brain tends to misinterpret messages in a negative personal way, which isn't what's meant, but that's a really common thing. I think the other thing also is talking to someone about who's your team around you. So obviously as health professionals you're part of someone's team, but you might see someone for an hour a week, an hour a fortnight. You're not there 24/7. Others in their life are. Family, workmates, friends, pets, all of those are a really important part of the team. And so encouraging people to think about teams approach is a really powerful thing as well. And just, I guess, not being afraid to ask those questions about, there's been lots of publicity around, are you okay? There's a lot of terror about what happens if someone says no. the training hasn't taken us to that next step.
What happens once you say, are you okay? And what we expect is someone to go, I'm okay. But what if they say no?
I think it's then having knowledge of 2 or 3 different services that you can link someone into, and sort of as a health professional, not sort of suggesting, but using sort of the power of the prescription, if you like. Saying, and also that connecting that psychological support to the physical benefits that come with it as well.
I think that's really validating for people to be able to say things like, we know from research for so long that low back pain has a huge comorbidity, depression and anxiety. And then I really like that idea of setting up, who's your support network, and go through that with people as a way of then saying, maybe if we add to your team so-and-so who's down here, and get them to answer things. It's a nice idea.
And it's a multidisciplinary approach. It's never a one person that can fix it all.
And I think encouraging sharing within a multidisciplinary team as well, and that can be really hard in private practice when you're in lots of different places. But using GPs, and increasingly GP surgeries have got allied health professionals on site who can act as sort of care coordinators or message coordinators if people are on chronic disease management plans, then making sure everyone's aware of that, and including the client, the patient, whatever expression you want to use, and their family as well, because sometimes if you're bringing a team in, the team members also need to know what their job is. So it's not just saying, okay, they're part of your team. But it is sometimes it's that communication, and we still find sometimes that team members don't react in the way you might necessarily want them to. Mental health is one of those areas where, because of stigma, because of cultural differences, some cultures have different beliefs around whether mental health or mental ill health is a thing or not. Increasingly we know that medication is a part of management, but it's not the mainstay of management for the majority of mental health conditions. But also seeking help sometimes from someone for counselling, for talking treatments, is a bit like walking into a shop and finding a pair of jeans. If you pull the first one off the shelf and you try them on and they're perfect, you're doing all right. But sometimes it takes trying 3 or 4. So encouraging people to not lose hope and give it another go. But knowing across the age range what services are available. Obviously GPs are a big part of that, and everyone needs to have a GP that they feel comfortable talking to and with. Headspace works with 12 to 25-year-olds and their families. In Albany there's Amity Health that works with adults and also under 12s with mental health support services. There's a whole lot of stuff online, self-help, if people are interested and motivated to go there. That's sort of an area that for people who are interested in online-based stuff, they'll do really well with. If someone doesn't engage with computers, online help doesn't really work because it's limited.
So how does a person find you or find Headspace, and how can they get in contact?
So online, we try and be in every sort of virtual space where young people are. So headspace.org.au.
Can they just walk in?
They can just walk in. So in Albany, we're up at the top of Middleton Loop. They can walk in, they can call, they can come in with a friend. We don't mind who brings young people in, and sometimes the best thing you can do is to go with someone as a friend, as a parent, as a health professional, saying, "Can I help you make that call, or would you like me to call them for you and book a time?" Because sometimes it's that first step.
And so then you guys offer counselling, or what's the service that you provide? Just counselling or other things as well?
Other things as well. So we try and have a sort of comprehensive health approach. So every Headspace centre will have mental health supports, drug and alcohol supports.
Meaning people trained in those areas,
mental health counsellors. So now we have clinical psychologists, mental health OTs, social workers, mental health nurses. We have drug and alcohol counsellors. We have GPs that come in 3 days a week that bulk bill young people, 12 to 25. We have vocational specialists as well. So we know that for lots of young people, anxiety and depression and other mental health issues can interfere with their ability to look for work and to find work and stay in work. So that's been a new program for us in the last 3 or 4 years that has just been expanded to half the Headspace centres in Australia now. And people can also access us online via Facebook or Instagram. So we try and be where young people are. Most of them will probably have had someone from Headspace come and talk to them at school as well. We do a lot of promotion and these sorts of talks to young people, how to help a friend. And
I think they are, young people, I think now seem to be have a lot more awareness. Certainly going back to when I was that age, there was nobody was talking about it. But now at least there is some awareness, which is nice, because there's also a lot of, I see a lot of high functioning, very competent, but also really impeding them from making health benefits. So people will come and I'll say, wow, really tight. I'm not stressed. I'll bite your head off telling you how not stressed I am. And I find that a really hard thing to approach. And I guess I don't know if you can speak to that a bit.
We sort of have an approach that, and this has been particularly one that we've found has been helpful with young fellas, because young fellas, well, all fellas really aren't very good at looking after themselves, and often feel, as a society, our sort of gender stereotypes suggest that guys aren't as in touch with their emotions and, just meant to bury that stuff and keep on going. But we sort of talk about mental health skills and coaching, and we do a lot of work based on one-off appointments too. So coming in, working out with a person what their priority issue is and suggesting some skills and strategies to deal with that. And sometimes that might be bringing family in too. But, I think you don't have to have a mental health problem to benefit from a bit of counselling, because it is just going and getting some life skills, really, coping skills. And so, we like to be working in that space where it's early days, and a little bit of teaching someone different ways of approaching problems or different ways of approaching managing stress or dealing with anger or interpersonal relationships as well as a big part of it. Might prevent things getting to the point where the chip in the windscreen spreads to blow the whole windscreen out. So we do sometimes a lot of bargaining with reluctant young people about how about we just have one chat, you know, only once. It'll get mum and dad off your back, and sometimes that's enough. Sometimes it's just having a neutral person say, "Hey, it sounds like you're doing okay, but have you tried this?" You know. And so, you know, that talk around helping someone who's somatising stress or has got psychological layers around chronic pain might be, okay, so this is what I can do for you as a chiropractor or as a physical health practitioner. You could get an extra 10% here. How about let's do a deal, go once, see what you reckon, and see if you've learnt anything that might help. And then speaking to the health professional, whether that's giving us a call and saying, look, this is what I've been working on and this is where we want to, I think the focus should be. And so seeking the permission of the person you're working with to make that call. Because we know that there's a huge benefit for helping tease out that psychological overlay and helping someone realise that there's a psychological overlay and that your mood can have a really powerful effect on your pain and your mobility and all of those things.
And sometimes just the realisation that your environment's really stressful, and it's really valid that you're stressed and anxious in that environment, and maybe you might need to go and look at how you can either manage that better or change that environment, because your response is actually really normal physiology.
Normalising is a big part of it too. Statistically, we'll know that 1 in 4 people will have a mental health issue at some point, which doesn't mean to the point of illness, but to the point of impacting on day-to-day functioning, yes. And sometimes that'll go away by itself, but usually it'll go away quicker with a bit of help.
So for us, can I talk about our scope of practice and what we can do to be on the ground, I guess, with people, and then what sits, further on outside of our scope of practice. For us, acknowledging and asking, and then potentially normalising if that's appropriate.
Well, we call it validating.
Validating, that's a better word.
Because someone might go, well, this isn't normal for me. Yes, but it is okay to feel how you're feeling now, and it is real, and you're allowed to feel like that, and given what you've been describing, that would be a usual thing for someone to feel that way. And then looking at asking about who their supports are and where they go, and is it okay for me to, I also adjust your mum, can I speak to her about that, or that sort of stuff. And then the other thing that
referring to the GP as well, which could be leading to a bigger
and then maybe like some basic breathing stuff.
Breathing,
like something that we could do, isn't it?
Body scans, meditating.
Meditation,
progressive muscle relaxation, all of those sorts of things are really useful skills. But they're like anything physical, you need to give it a go, make it a part of your routine so that you can call on it at a time when you're in pain or when you need it. Just pulling the book off the shelf for the first time when you notice the pain's there, it's probably not going to be as powerful, but all of those things can be really helpful. Sometimes for someone who's reluctant to look at that sort of things, it might be doing a bit of bargaining as well, like saying, okay, so if we're still here dealing with things the same way in 2 or 3 or 4 weeks' time or whatever, can we do a deal now that if you're still feeling that way, you'll give this a go? And so that might be another window into looking at mental health stuff for someone who's reluctant to, or who maybe doesn't necessarily see or acknowledge that psychosocial or psychophysiological link between pain, all those sorts of things. And then, sometimes being prepared for someone just to not be open to it too, because that happens to us. It's being it's saying, well, I'm still going to be here, and even if someone disagrees with you, leaving the door open.
Yeah.
Yeah.
Any other questions, guys?
Well, I'm quite interested in the whole young people aspect. And so the biggest issues are depression, anxiety.
Yeah, we tend to not work with a diagnostic focus. We tend to work with an issues-based focus.
Okay, right.
So across a spectrum of 12 to 25-year-olds, those issues will be markedly different. So, younger 12-year-olds, it's transition from primary to high school. It might be family conflict. It might be school-based stuff, so bullying, relationships, big life transitions. It might also be things like school refusal, which is different to wagging school. It's when someone is actually struggling with often anxiety about being in the school, and where the system knows about it but is struggling to deal with it, whereas opposed to wagging, which is where it's hidden and it's and no one knows about it. Through to 24, 25, it might be work-based stuff, intimate partner stuff, again, similar sorts of things. But if you boil down to what the impact of that issue is, it's anxiety first, depression second. Eating disorders is a big part of what we're working with now. Body image sort of related issues, the impact of mental health stuff on people with autistic spectrum disorders as well. There's a whole broad range, but definitely the two biggest mental health issues for young people, but for people generally, are anxiety and depression. So that's some of it also is recognising that these are normal human emotions, but they start to become a problem when they are interfering with multiple life domains, or where they're prolonged and there may not be an obvious cause, and where they're knocking someone off their usual trajectory, so interfering with their ability to complete their day-to-day activities, whether that's not being snappy at home, or not feeling like going to work or school, or not performing on the sports field like they used to, or withdrawing from their friends, or just feeling like everything's a little bit pointless.
And so with this Christmas and New Year season coming up, and with COVID that's been happening, any advice you can give on dealing with some of the anxiety and possibly depression that some people might be experiencing? Yeah,
sure. We get asked this question often, and as health professionals we launch into these big long spiels around what you should do. The best advice I had though was from someone the other day. He said, just make sure you have naps sometimes. So rest. It's a really busy time of year, and everyone has these expectations that because it's Christmas and because it's summer, and because for young people that might involve returning back to Albany from uni, or friends returning back, or family coming to visit if the borders allow us to do so. Expectations are high. Everyone has to catch up with everyone and be on their best behaviour, and families who may not see each other at any time of year expect to come together and for everything to be harmonious. Giving yourself times out from that, being honest with yourself around how you're travelling is a really powerful thing to do, I reckon. So scheduling breaks.
And a check-in on yourself.
Checking on yourself and your loved ones around you as well. Keeping up a bit of exercise as well as all the gorging on food and silly season stuff.
All right. Thank you very much for coming in.
Absolute
and
pleasure.
with us.
Thanks for having me.
Thanks.